Welcome to the early childhood development portion of this growth and development series. In this video, we're going to focus on early childhood development, which spans roughly ages 1 through 6. This stage includes toddlers and preschoolers, and it's a time of huge growth in language, independence, thinking, and social skills. Early childhood shows up a lot on HESI, especially when it comes to behavior, discipline, toilet training, and what is considered normal versus concerning. During early childhood, kids are mastering several major developmental tasks at the same time. They're rapidly developing language, learning social interaction, gaining self control, and forming their self concept. These skills don't develop in isolation, they build on each other. If a child is trying to be independent but isn't perfect yet, that's normal, and it's okay for us to allow them to continue to try. Two of Erickson's stages apply to early childhood. Now, toddlers are in the autonomy versus shame and doubt. This is where you see things like saying no, wanting to do things themselves, and getting frustrated when they can't. Preschoolers then move into initiative versus guilt, where they take initiative in play, ask lots of questions, and use their imagination. Now, a toddler saying, I do it myself. This equals autonomy, not misbehavior. Now, toilet training is a major milestone during early childhood. Children must be physically ready and able to communicate their needs before toilet training is successful. Most children achieve full bowel and bladder control between roughly 3.5 and 4.5 years, but variation is normal. Now, forcing toilet training before a child is ready often leads to frustration, not success. So, your HESI tip for toilet training is that readiness matters more than age. A child's physical growth during early childhood is still rapid, though not as fast as infancy. By age 2, birth weight has quadrupled, and all 20 primary teeth have usually erupted. Adequate nutrition is essential for brain development, essential for bone growth, and essential for immune function. So, balanced meals and healthy habits should be encouraged early. Now, cognitively, children in early childhood are in Piaget's pre-operational stage. Their thinking is egocentric, meaning they see the world only from their own point of view. This is why young children may think something happened because of them or assume everyone feels the same way they do. We can often see this actually during hospitalization of an early age, early childhood kiddo, because sometimes, unfortunately, they believe that their illness or why they're in the hospital is because they did something wrong, which is a bit disheartening, but just to remember that while we're taking care of them. Now, Again, egocentric thinking is going to be expected in preschoolers. At age 2, children have a limited understanding of cause and effect and may have tantrums out of frustration. Let's be real. I'm a full-blown adult, and even I have tantrums out of frustration sometimes, right? But nonetheless. Now, at age 3, children are very rule oriented and they like routines. They like consistency. By age 4, impulse control begins to develop and they can better regulate their behavior with adult guidance. Now, tantrums, like we talked about in toddlers, these are developmental. They're not defiance. They're trying to figure out how to handle their emotions. Now, according to Kohlberg, preschoolers are in the pre-conventional stage of moral development. They understand right and wrong based on punishment and reward, not intentions. Discipline during this stage should focus on teaching, not punishing. When timeouts are used, the guideline, okay, and this is also, I've seen this multiple times, so I'm pausing for dramatic effect and I'm going to repeat it over before I even finish it. When timeouts are used, the guideline is 1 minute per year of age. So if we have a three-year-old and we're going to be using a timeout, how many minutes should we have them sit in that timeout? You got it. 3 minutes per each year of age. So our discipline should help guide behavior for these children, not shame the child for what happened. Language development during early childhood honestly is impressive. A helpful guideline to remember is that the number of words in a sentence often equals the child's age in years. So, reading, talking, and responding to children supports both language and cognitive development. Okay. Perfect example is with my nephew, who at the time of recording this video is 3 years old, where I feel as though I don't see him for 2 weeks, and all of a sudden, when I see him again, it's like his language has flourished and developed that much more in such a short time span. Okay, now, if we end up seeing language delays, this can end up signaling developmental concerns. Play is the primary way children learn in early childhood. 2-year-olds engage in parallel play. So think of parallel lines. They're next to each other, but they don't touch. So meaning that they play alongside others, but not directly with them. They might be playing with blocks, and then their little buddy is playing with blocks too, but they're doing it separately by themselves. 3-year-olds, this is when we start to see cooperative play start to happen. So using imagination and interacting with peers. Maybe it's they're cooking you up some fake food in their little kitchen and bringing it to you for you to eat and drink. Secure attachment is built through consistent affection, holding, hugging, and responding to needs. Early childhood also requires constant attention to safety because curiosity increases faster than judgment, if you know what I mean. Okay, so we want to make sure that we're preventing accidents, especially when we're um, looking at the child becoming a bit older. So, towards the end of this developmental stage, so around that 6 years of age, if they're starting to ride bikes, we want to make sure they're wearing helmets, um, sports appropriate protective equipment, so on and so forth. Now, immunizations. Okay, so active immunization schedules continue throughout early childhood. Vaccines protect children during some of their most vulnerable years and help prevent serious communicable diseases. Now, I understand that everyone has their own thoughts and beliefs on immunizations. I can assure you that your exams are going to be testing on textbook regulations when it comes to immunizations. Okay, so not making sure to keep one's personal beliefs and opinions out of it, and focus on the medicine behind it. So as nurses, we play a key role in educating families about vaccine schedules and compliance. Okay, so now our key takeaways from early childhood. Remember this: independence is developing, egocentric thinking is normal, play is learning, discipline should teach, it shouldn't punish, and safety and supervision are essential. All right, we made it through another one. We're getting there. So, in the next section, we're going to go ahead and talk about middle childhood. So, ages roughly 6 through 12. All right, I'll see you in the next one.